There we go. Okay, guys, I'll go ahead and get started here. So this is our lab portion of our class. So I just want to make sure that the two of you who are not into the lab stuff yet know what you're doing to get in there. So basically on your Canvas page, I put this announcement under announcements about lab. So all you have to do is this course ID is important for you. So I would copy and paste that. But if you go into this Evolve instructions, it tells you what to do here to get in to self-enroll in the course. You have to use your Herzing email, because if you use some other email, I won't be able to see any of your progress in Evolve. It has to be the Herzing one. So please make sure that you do this today, the two of you who are not in here. And if you have problems or you're running into questions or something, please let me know so I can help you. So those are your instructions on how to get in. So that's in your announcements. Okay, let me pull up the other screen. Okay, so this is on the Evolve website. So our thing, here, let me step out of this a second so you can see what I'm talking about. So basically, when you get in here, you should see this book right here, Essentials of Nursing Practice. And you should see the course ID with my name in it and everything. So when you click on it to get in, you should have all of the course content here on the left. And then like this week's stuff was supposed to be module 4. So if you click on module 4, it's safe medication preparation. You get in and look at the lessons. There's so many lessons to look through. You get and do all of that. And then there's these post tests. So you have to do each one of these post tests. And then you also need to do this module 4 exam, which those aren't long at all. I thought they would be longer than they are, but they're not. So it shouldn't be too bad. You just need to spend a little bit of time reading some of the stuff and going in and doing these tests. So as far as these tests go, you have 3 chances to take them for each one of them. And you need to, score pretty decently on all of these. So especially like, we said, I think we said, 76 or above, you have to pass everything, of course, to be able to pass lab. But we would like to see you, up around 80, 100%, if that's possible for all of that. So please, retake them if you need to. And if you're having trouble, please let me know so I can go in and help you a little bit with that. So anyway, that was this week's stuff. I did post on Canvas, I have like a syllabus kind of a thing for lab. So I can send that to you in email as well, just so you have a copy of it. So it's easier to look at if you wanted to print it out. I do have it on Canvas, but I don't think it's as easy as to look at as this is. So I could send that to you if you want. So a lot of the topics that they have us going over this term, some of it is new, some of it is not for you. Like I know that you guys went over stuff about medication administration last term and funds, but just take this as a kind of a little bit of a refresher and to brush up on it. Like next week we go over parenteral meds and It gets into a little bit more about IV stuff, which we didn't do a ton of IV stuff last time, so maybe this will be a little bit helpful. And then some other things that we do during the term, there's stuff about central lines in here, which is really good. So that would be something that we could do. And then there's stuff about airway management. And I think they had some ostomy stuff, chest tube information, giving units of blood. So there's some things that are new, some things that are not. So the things that we have already done before with ATI modules and stuff, or maybe you've done on here from last term, I tried to make an alternative assignment for you instead. So like with the airway stuff, this is week 8. I made it so that, I think it was airway. Or maybe it wasn't airway. Let me look at a different one. But anyway, the ones that you've done before, like, you know, the tube feed type stuff, I tried to make those be like an ATI assignment. So you could go there and do that module and print out that report and turn that into me instead of doing it on here because you'd already done some of this on here before. So that's kind of what I was doing for those alternative assignments. So anything that would be an ATI assignment, I would want you to turn into me on Canvas. So I'll make sure that I have some type of spot specified for that, so you'll know exactly where to go for that. I'll work on that today. Does that make sense, everyone?
Does it, like, on our syllabus or addendum or whatever, does it say what like activities we're doing on ATI versus what we're doing on here, or you said you're still working on it?
No, I thought I put that on here. I'm looking at the one I printed out though. Maybe I didn't do it on this specific one here. Let me look at my other thing here. Hold on. So basically, you know what ATI modules are like because you guys had to do some last time. So when you go in there, you basically, usually they have like a pre-test, and then you have the module itself, and then they have a post-test at the end. So we want you to do the pre-test, go in, do the module, spend some time in there because there's a lot of things in the module where they'll have, you know, videos you can watch, they'll have things you can read, they'll have practice, you know, like case study stuff in there, whatever. So spend some time in there and do that stuff. I would like to see you at least spend an hour in those ATI modules if at all possible. So, you know, at least do that. And then when you print out your report, I want it to be the module report so it shows how long you were spent inside that module. And it'll also show that post-test score on there. So you don't have to print out another thing about the post-test because it should be on that module report. And that's what you would, you know, turn into me is just that report with those things on it.
So the ATI modules that you have assigned, where can we find those? Is it all on the syllabus? Because there's a lot of things that I'm like, okay, so there you go to modules, you go to syllabus. It's not all in one place. So I find it hard to keep track of.
I know, I get it. Well, I'm going to give you this specific paper. I'll send it to you guys. So you'll have this, you'll have this specific paper for lab. Okay, so I'll send this to you. That way you'll know just to look at this for what you need to do in lab. So on here, I'm looking at the one that I had saved. So week 8, it is the airway one. Okay, so in the middle portion, which let me see if I can share this because I don't know. Let me see, hold on.
All of it is also broken down in like the addendum, like for lab, like it has all of the dates and stuff in there. Like I was just looking at that and it's the exact same thing as you just pulled up.
Yeah. I just thought I'll send this to you anyway. That way, if you just want to have the copy of it that you could look at easily, you know, it'll be right there. So on week 8, so here's the ATI airway management. So you're going to complete the pre-test in ATI, complete the post-test in ATI, after you're done with the module, save the report showing the time in the module and the pre and post test results and send it to me. So that's all you got to worry about. So I figure I'm pretty sure you guys did Airway last time in this. That's why I made it an ATI one. And then week 9 is another one. So I know Ms. Pittman did like a chest tube thing with you guys last term, which I don't understand why she chose that one, but that's okay. We'll just do the ATI one instead. And then let's see, week 12 is another week that we do this. So enteral tube feeding, you already did stuff on this and Evolve for that. So I put an ATI one in here for you to do instead. And week 13 is another week that we do that, about the ostomy care. So I think it's those 4. 1, 2, 3. Yeah, I think it's just those 4 weeks that we do that. So does that make sense to everyone? I just didn't want you to have to do the same thing over again. That's just stupid when you've already done it. So I figured we'll do something that's similar, but you know.
Mm-hmm.
Okay.
Yeah, okay.
A quick question.
Yeah.
So for like each week, it says complete math activities.
Yeah,
What is that about?
that would just be when we meet for lab.
Oh, okay.
Yeah, I'll just do some math things with you when we meet, and that way we'll be hitting that. So I don't know if you've looked at this schedule very much, but there's someone in Wisconsin actually made this, and I kind of just, fixed it a little bit for us for these ATI things. But anyway, some of the weeks it'll say, I'm trying to find one. It'll say something about like an oral checkoff. Trying to see where that is. So like, look at week 7. So it's talking about a central line dressing change and also parenteral nutrition. So like that week when we meet for lab like this, I would want you guys to be able to tell me verbally, like some of the steps that you would do to do a central line dressing change. Okay, so first I would go and I would wash my hands and I would do, you would like do that to me. And then when we do come back to campus, whenever that may be, we'll have some day that we'll have everyone come and we'll do actual skills in the lab and we'll check you off officially that way. But I do want you to be able to have some knowledge of the skill to be able to tell me, yes, this is what I would do next and go from there. Does that make sense?
Yeah.
So every time on here that you see some type of skill, I may ask you when we meet for lab to tell me some things about that skill. Like next week, I think we have some of the injections. So I might ask you, oh, how would you find IM spots, and you would have to tell me how to find those and that kind of thing, So just have a little bit of knowledge about that skill every week for when we meet so we can go over those things. Questions about any of that?
No.
Okay. So this week, I don't know if you guys got anything out of what you did or not. I know you've done some of that stuff before, but with safe medication administration, some of the things to think about would be, all of those rights of medication administration, right? So what are those rights?
Dose, time, medication, routes,
Okay.
and
What
the
else?
last documentation.
Okay, good. And what other kinds of things are important to consider when you're going to give a patient a medication? Tell me some things that are important to think about.
Blood pressure.
Blood pressure. So especially if you're going to give a cardiac med or something that's going to affect blood pressure, right?
Yeah.
So you should always take a blood pressure before to make sure that they're okay to get the med. And then after you give the med, you should recheck it, right?
Mm-hmm.
Okay, what else?
Pulse.
Pulse. Okay. Sometimes you have hold rates on certain meds. So in your order, you may have something that says hold if the heart rate is less than 60 or the systolic blood pressure is less than 100, you know? So you would have to look at those things. So that means you would have to do a blood pressure and a pulse before you would ever give that med. What else?
Or insulin medications, or insulin shots, maybe like knowing what their sugar level is before giving it.
Yes, that's a good one. Other things to do with that, it's good for you as a nurse to look back and see what they've been running like the past few times. So like if it's in the morning and you're going to do their morning blood sugar, you want to see what they've been running the past few days. So in the morning, have they been running really low every morning? Or have they been in a good range? Or have they been really high? It's good for you to know. Because, like, say they've been running super low every morning, but no one's called about it. That's a problem. So you'll see that sometimes when you practice that other nurses maybe didn't address it or something and they didn't call. If the physician doesn't know that this was a trend the past few days, then he's not going to change anything, and maybe something needs changed, right? What else?
Maybe nursing notes from the previous.
From the previous shift or something? Okay. What about labs? Labs are super important to look at before you give medications sometimes. So what kind of medications will affect, some of your electrolytes? Think about that.
Diuretics.
Diuretics, definitely. So if, like, say I'm giving Lasix to someone, if I have that on for my morning meds that I'm going to give someone, what kind of labs would I want to look at to see if it's okay to give that?
The potassium levels.
Okay.
Um,
Because what can Lasix do to your potassium level?
it can increase it.
Well, it's going to make it be low.
Oh, it's rather the detergent things.
Yeah, it's going to make it low. So, like, for instance, if I give furosemide to someone, if their potassium level is 3.4, which is already on the low side because we like 3.5 to 5, if I go ahead and give that without treating their potassium level, it's going to make it go even lower, and they're going to have some cardiac issues probably. So I used to work on a telemetry unit, and we used to send people for different cardiac tests a lot, And so anytime someone would be ordered a stress test, I don't know if you've ever thought about this, but the people that do the stress test over in the stress lab, they would call the floor and they would be like, oh, I noticed that your patient has a potassium of such and such this morning, 3.3. Did you guys treat that yet? They'll ask you because they would not take them for their stress test if that was not treated. So there's a lot of things like that that you need to think about. What else would you want to look at lab-wise that might be important when you're going to give medications? Didn't you guys have something in your reading this week for this stuff about peak and trough?
We did.
Okay, so typically you're doing peak and trough levels for certain antibiotics, right? So usually it's vancomycin or gentamicin, one of those types of drugs. And so it seems like everyone under the sun's on vancomycin. So if you had that ordered, like you were going to do your med pass and you had that ordered, you would need to look and see if you had an order to do a peak or trough, or if there was one drawn, you would want to see what it is, right? What's it mean if, what do the peak and trough mean?
So for the peak, I think you take it 30 minutes after the medication, and the trough, you take it 15 minutes before the next dose.
Okay. What do they mean though? So what's the peak mean?
When the drug is at its highest level,
Yes. And then the trough would be what?
Lowest level.
Okay. So the purpose of this is you want to make sure that you have a certain amount of this medication in this person's system to make sure it works really well. So sometimes, you know, a physician might order a certain dose of vancomycin for that patient, and then maybe when they do the peak and trough, it's too much for them. So they would have to back off on the dose. Or maybe it's not enough for them and it's not working as well as it should be. So they need to go up on the dose. So that's kind of what those are about. So those are something that you would need to look at in labs. Anything else you can think of that would be important with labs to look at? So there's certain medications that have blood levels, right, that you have to draw. So like digoxin would be one. You would need to know what your digoxin level is. So if that was a medication that you had ordered that morning to give the patient, you would want to make sure that, you know, you weren't toxic with it or something, right? Same thing with a lot of other medications. There's like, you know, Dilantin is another one, you know, so a seizure medicine. Even Synthroid, like sometimes when people take Synthroid, they'll come into the hospital and their level will be super low because they haven't been taking it right, you know? So you need to look at some of that stuff to make sure that it's safe to give that medication. All right, so when you go to give meds to someone, tell me like some of the things you would do first before you go to give them their meds.
Patient identification.
Okay.
Ask them if they know why they're taking a certain med.
Okay, that's good. Yeah, because most people don't. What else? So you want to make sure that you know what each med is for too. So like if you need to look something up, because I'm telling you now, when you go practice, there's so many new meds all the time. It is hard to keep up with everything. Eventually, after you've practiced for so many years, you'll remember a lot of it. But sometimes you need to look things up a lot. You know, just I still do, you know. So you have your time before you go into the room and you look everything up to make sure you have basic knowledge about what things do and that kind of stuff. If the patient asks you what it's for, you know what to say, you know. Other things that you would do, if there's any kind of medication calculation that you need to do, you're going to do that before you go into the room. Make sure you're giving the right dose. Of course, you're going to wash your hands and all of that. Anything else we're forgetting?
Explaining what each medication does and why you're giving the medication to the patient.
Yeah. So you guys haven't really had a chance to give meds at clinical yet, have you?
No, we
haven't.
just followed the nurses around and they
Okay.
just showed us what they do as far as getting the medications and giving them to the patients and stuff.
Okay.
Well, that's what we did at ours.
Yeah, I hate that we are doing it this way right now because you're kind of missing out because this term you would be doing a lot of that right now. So when we do finally get out of this, when you do clinical again, whoever has you for your clinical instructor needs to be aware that you're kind of a little bit behind on that stuff and that you need to, start to feel comfortable with passing meds and everything. So when you give meds, what I've noticed with students in the past is they get really too much in a hurry when they're doing this. Like they know that they don't have a whole lot of information about these meds in their head. So they're trying to like remember everything and they do everything too quickly. So they're opening up all of the meds and they're just popping them all in one cup, which I want you to get in the habit of, okay, you're doing your 3 checks of your meds, right? And so one of those checks should be, okay, here's my med. I'm going to hold it up to my order to see if this is what I needed. Yes, this is what it was. And I'm going to verbally tell the patient what it is and what it's for. And then I'm going to open it in front of them and put it in the cup. So that way they know what you're giving them before you put it in the cup. Because you'll have so many patients that'll be like, oh, what pill is this? After you've already opened everything and you'll be like, I have no idea. I already, there's 3 million pills in there. I don't know which pill that is. Or they'll be like, oh, I changed my mind. I don't want to take my Lasix today. So you need to fish that out of here. So you need to do it a little bit slower because that gives them the opportunity to say, oh no, I don't want that or something. And then you could put it aside without having to like fish through everything. You see what I'm saying? So many patients do stuff like that. It's crazy. Okay, so I just wanted to talk a little bit about some of the stuff you guys did this week. So that's all I'm going to say about it. But for next week, again, we're doing IM, sub-Q, and intradermal injection information. So make sure you have a little bit of a basic idea of what you would have to do those skills to be checked off so we can kind of talk about it. All right, so the rest of the time, I just want to work on math with you. So I'm going to give you guys the code to get into your practice math test. So let me flip to that so I can find it real quick. Okay, I just put it in the chat in Zoom here. This is the code to get into the practice math. So you would go onto Canvas to go to that. In here, I made it so that you can take this multiple times. So you have unlimited times to take this. It'll keep your highest score, which it doesn't matter because it's pass-fail anyway. And then I have checked that it'll give you feedback. It'll show you correct responses, all that kind of stuff. So hopefully you'll be able to get in and out of here a bunch of times. So everyone see if they can get to this practice math test real quick and pull it up because I kind of want us to look at it together to make sure there's nothing that you don't feel good about, because if there's something that you don't understand how to do, we need to figure it out now.
Is it the Unit 1 dosage calc exam practice?
Yep. Does everyone see it?
Yes, I do.
Okay. So what's on here first are some conversions. So let me just flip back to where I'm at here. Okay. So the first 1, 2, 3, 4, 5, 6 questions or conversions. So you need to know micrograms to milligrams, teaspoons to milliliters, milligrams to grams, pounds to kilograms, and grams to milligrams, milligrams to micrograms. So do you guys feel pretty good about conversions like that or not?
Can we just go over the teaspoon one?
Yeah, so 1 teaspoon equals 30 milliliters. Or excuse me, I said that wrong. 1 teaspoon, oh my God. 1 teaspoon is 5 milliliters. And what I was trying to say, which I said stupid, was 30 milliliters equals 1 ounce is what I was thinking of, but we're talking teaspoons. So 1 teaspoon is 5 milliliters. If you had tablespoons, 15 milliliters equals 1 tablespoon. So that's the difference between teaspoons and tablespoons.
So for this one question, it says something about dobutamine 7 micrograms per kilogram, and then it gives you like a patient weight. So you would have to convert the pounds first, correct?
Correct. Well, here, let's make sure everyone's good with these first few first, and then we'll go do that one together. So other than the teaspoons, everyone else good with the other conversions?
I don't know if you wanted us to complete it first, because I feel like everybody has different questions. Like,
Yeah, because my first question is the one with the pounds.
Well, I kind of just wanted to flip through here to see what types of questions there are first. And that way you can say, oh yeah, I know how to do that. I've done that before.
Oh, so we're not actually doing it right now.
You can do it, but I wanted to do this first so I can tell you how to do something if you don't know how to do it, is what I'm getting at.
Oh, okay. But you said we can go in multiple times.
Oh yeah, yeah, definitely. All right, so let's look at that number 7 for a second. So anytime you see a question like this, where it gives you weight in pounds, you always need to change that to kilograms. So in this question, it says the order is for 7 micrograms per kilogram of this medication, and this is the weight. So you need to change the weight to kilograms so you can figure out this.
So do you just divide by the 2.2?
Yes.
I know there's like the 2.2046, but should we just stick to the 2.2 or just do the whole thing?
Do the 2.2.
You're talking about number 7, but that's not the question I have, so I'm kind of all over.
The questions are mixed up. We're not all going to have them in the same order. She's just...
This is the dobutamine question. Look for the dobutamine question, where it starts with Harriet. Find that. That's the one we're looking at.
See, I have a dobutamine question, but it starts with Joanna. And like it's number 4 for me.
Yeah, that's a different one. We're looking at the one with Harriet.
Okay. Well, should I just put in the wrong answer to find that one? Because I'm not there yet.
Oh,
like you know how,
yeah,
like you know how I'm like I'm on number 4, but I don't want to. I can't skip to get to the question that y'all at. But it's probably like the same type of question that I'm on right now, so I'll just listen to y'all.
Yeah, it should be the same exact type of question, honestly. So basically, you're fixing your weight. You're doing that divided by 2.2, and then what are you doing?
Then you just set up like the ratio. So you would do 7 micrograms over 1 kilogram equals blank over the kilogram weight, which I got 149.18.
Okay, so what do you get when you figure all that out?
I'm putting it into the calculator right now. I got 98.
I think you did something wrong. Here, I'm trying to find my calculator so I can do it. All right, here, let me do it real quick.
Quick question.
Yeah.
So when you divide the weight by the 2.2, I have a decimal. So should I round or should I like leave it alone? Because like at the end when it asks for the final answer, it tells
Yeah.
you what to do. But as far as when I get the weight divided by the kg, do I
Okay.
round that? Because it's like 79.5 right now. So should I make
For-
that an 80?
For these tests, if you have your calculator, just leave it exactly like it is in the calculator without rounding, and then do your next step. So in this particular question, all we're doing is we're dividing by 2.2, with that 328.2 pounds, and you should get something, here, let me do it again. 328.2 divided by 2.2 is going to be like 149.1818, repeating. So you take that and you're going to multiply it by 7. And then when you do that, you should get 1044.2727 repeating. So it says round to the nearest 10th. And so the 10th place is that first point, right after the decimal. So it should be 1044.3.
Okay, and one more question.
Yes.
You just multiplied it by 7. I'm
Yes.
not on this problem. Is the 7 the MCG?
Yes.
Oh, okay.
So the whole thing with this, if you're like writing it out on a piece of paper, so it's that weight times that, because your weight is in kilograms, and then this is 7 micrograms per kilogram. So you could essentially get rid of your kilograms altogether. You see what I mean? And you just have to multiply. You don't have to do any kind of dividing or anything.
Oh, okay. I see what you're saying. So it's really not a need for an equation, in all honesty.
Yeah.
Okay.
Exactly.
So then you said the answer was supposed to be 1043, right? Is it so? Because a 7 is a 10.
1044.3.
Okay.
Okay. And then that same type of problem is in that one with Joanna that Tanisha was just talking about. So
I just did it and end up with after I left the long problem dividing the weight by the kg, it was like it was this long thing. So I multiplied it by the 18, and then I got 1,431.81818181, and it said round to the nearest 10. So I just left the 8. If that makes sense.
Oh, this one didn't work out the same way. Hold on. Oh, I see why. All right, so in this one, it says you have an order for dobutamine 18 micrograms per kilogram. And so look at what it says. How much dobutamine should Joanna receive? List your answer in milligrams. That's why it's different. I'm like, wait a minute, this isn't working right. So you have to convert it, because what you had was in micrograms, so you need to convert it to milligrams.
Okay.
I have a question.
Yeah.
So there is this one, it says you're admitting a patient in room 5010, 5010, the one with the label. Do you have that question? Because I was kind of confused on that one.
Oh, let me see if I can find it. Everything's in a different order. So is it the label that says buspirone?
Yes, that one.
Okay.
Did you get 20?
Yes, 20 is correct.
All right, I have a question on, okay, so it says the MAR reads give Zosyn 3.375 grams and 50 milliliters, and then it asks like how many milligrams per milliliter are in the piggyback. So how do you set that? I mean, I think I know how to do it, but like, I feel like I'm doing it wrong.
Let's see. What are you doing?
So would you convert the 3.375 grams to milligrams and then
Yes.
put that over the 50 milliliters and then get a new, like, I don't know.
What do you get when you convert the 3.375 grams to milligrams?
3,375.
Okay. Wait a minute.
Go. Get out of here.
So the answer to that one is 67.5. So I'm just trying to figure that out. Because the way I did it, on the
Oh, okay. So if you do it, if you get, like, I just did it and I got 67.5. So basically, I guess it just makes you convert the grams to milligrams, and then you just divide it by that 50 ml.
yeah, yeah.
It's weird. I thought there was going to be like another step in there or something.
Yeah, it is kind of weird.
I have a question. For one of the questions, it just says to enter a numeric value only. Does that mean, are we supposed to round up or just not put the decimal part of it? Because
Which one are you looking at?
the one you're totaling a patient's oral intake from breakfast?
Oh, the intake and output one?
Yes.
Let me find it. Oh, here it is. It just means that you add up how many milliliters it is, and you shouldn't have to do any kind of rounding whatsoever. You just put whatever you got. That's what it means.
Well, I got 914.133. I was wondering if I should just put the 914.
Well, the answer is 940.
940?
So, yeah. So remember, 1 ounce equals 30 milliliters. So, and then remember, ice chips is going to be half.
Can you repeat that again?
So 1 ounce equals 30 milliliters. And when you have something that has something about ice chips in it, like this says 200 milliliters of ice chips. So you're going to count it as 100 because it's ice chips.
Oh, okay. And then you said earlier 1 teaspoon is 5 milliliters, correct?
Correct.
Okay.
What are you considering 1 cup, you guys?
Wouldn't it be 240 milliliters?
I think so. Let's make sure that's correct if someone wants to add all that up. So 12 ounces would be like 360 milliliters, right?
Yeah.
If we did 1 cup, you said 240, and then the ice chips would be 100. And then 1 cup of Jell-O would just be, I guess, another 240. Let me see. Does that work out right? Yeah.
Yeah, 940.
Yeah. Is there anything else in here that you're seeing that you don't know how to do or you're unsure of? Did you guys ever do those timed things where it'll say, oh, I started an IV at such and such time. What time is it going to be done? Did you ever do anything like that?
No.
I'm doing that one right now. So like if you once you get the answer for that, like let's say because when I did mine, it was the 1 liter of D5 with the 20 of MEQ. So it's infusing at 125 milliliters per hour, and then it says a new bag was started at 13:15, and then it asks you what time. So if the answer I got, so I got 8 as the answer, would you just add like that's 8 hours to the time that it was started, correct?
Let's see. Yeah. Yep. So if it was started at 1:15, then what time would it be?
9:15.
Yeah. So you would put 21:15. So you'd put it in military time.
Okay, that makes sense.
Yeah.
So it just makes you do an extra step of actually adding the
Yeah.
time.
Yeah.
I do have a question. So you were saying we can redo this, right?
Yeah. You can do this as
Because
many
I
times
had
as you
to
want.
skip a couple to get to the initial question you were asking. So I'm like, well, I'll do
Yeah.
this.
You can do it as many times as you want. So basically, when you take your first math test next week, it should look pretty much just like this, except it'll be different numbers.
Okay.
So same types of questions.
Also, I have a question about the lab modules. So I know like for each week or whatever, we have a different assignment to do. When are those like officially like due? Like the week or the day of lab or the day after? Like how do you?
On your schedule thing, I have due dates on there. So like this week's stuff is not due till the 10th.
Oh, okay. I thought it was like due on that day. I
No.
probably missed the due date.
No. So you pretty much have like a week to get everything done.
Okay, that makes sense.
So everything will have a due date. So the other thing too, remember this, I know a lot of you like to go way far ahead on everything, which I get it. I know why you do that. But with some of the stuff, like especially with clinical, with anything you do clinically, do on the day of clinical, please, because you need to get your hours in, and that's how you're getting it in, by doing that stuff. So if you do it ahead of time, then what are you going to do during your clinical time, you know? So try to stay on schedule with what you're doing. Same with lab, really. With lab, you should be trying to do it on this day instead of going way far ahead. Like you can do some of it if you want, but don't go too far ahead because you need to get your hours in. Did you guys get to that question about labetalol with the label?
Was it asking how many pills she was supposed to take or how many milligrams she's getting?
Yes.
Yeah, I think I just did that.
Did you get it okay?
Yeah, well, because isn't it just like if she needs to take 2 tablets or whatever, you would just take the 1 milligram and multiply it by 2, or like whatever one tablet, like the amount of milligrams in that one tablet.
Well,
Unless that's a different question.
that might be
You
something
talking
different.
about the weight one?
No, this is a specific one about labetalol, and it has a label that goes with it that you have to look at the label to answer the question.
Is it like 200 milligrams per 40 milliliters?
Yes, yes.
Yeah, I didn't get to that one yet. I was looking at a different one.
Okay. This one, I was just going to say, if I don't know how many of you do ratio proportion when you're figuring this stuff out. That's all I do. But For this one, if you write down what the label says, that 200 milligrams over 40 milliliters, and then the only other thing the question gives you is that you have 23 milliliters of labetalol that you're supposed to get. So you're going to put that on the other side of your equation next to milliliters. And then you'll have your X on top, and you'll just have to figure out how many milligrams that way.
I think that one was 115, right?
Yeah. Yeah. I was gonna say, let me see if this works. I don't know if this will work or not. So all I did was this. And it's hard to see this way, but
Mm-hmm.
The answer was 115, right?
yes. So anyway, when we do meet for lab like this and other weeks, we'll do some other math things too, just throughout the term, just to make sure you're staying up on how to do certain things. Because if you don't do that every so often, you forget stuff. So
The question about vancomycin 1.5 gram in 100 milliliter of amoxicillin running at 15 milliliter per hour. Can you explain it? I don't know if the answer I got is correct.
if you have vancomycin 1.5 grams, that one,
Yes.
okay. So basically for this one, you just have to change this 15 or 1.5 grams to milligrams. So if you change it to milligrams, what do you get? Don't you get like 1500 milligrams or something, right? So
Yeah.
if you have that, then you're going to put 1500 milligrams divided by 50. Or actually, that didn't work out right. Hold on. Oh, I'm sorry. Yeah, hold on. Let me fix that. All right, so if we do this, hold on, I'll write it on the whiteboard here in a second. Let me just make sure I have this correct. So this is saying that the correct answer for that is 15. What did you get?
I didn't get that. I got 6 to something. 6. Yeah, the 6 point.
Because like
Nothing.
if we
Waiting
do
for
if we do it like we did for those other ones, like that were up a little further, you basically you have to change the grams to milligrams for sure. So that would be 1,500 milligrams. And it says it's in 100 milliliters of normal saline. So if I did 1,500 divided by 10, that would be 150.
Could they have multiplied the 50 by the 100?
I'm just wondering how they
Nah,
got
that
the
would be
15.
yeah.
Hold on, let me see something. Is anyone else getting that right? I wonder if they're wrong.
Would that be like 0.75? Oh, hold on. 0.75 times 1,000. 75. Would that be it? That's a milligram. Because there's 1.5 grams in 100 ml.
Mm-hmm.
You're asking half of that.
I know. I just feel like this is a
Would be-
wrong answer that they have in here because I can't get 15 no matter what I do. Do you guys get that at all? Is anyone else able to get that?
Per ml. Oh, hold on.
What question are you guys talking about?
It's the one that's talking about vancomycin, 1.5 grams in 100 milliliters of normal saline, running at 50 milliliters an hour. Do you see that one?
Oh, I had 15. Is it the
You-
one that was asking the mg per ml?
Mm-hmm.
Yeah.
Yeah, I had 15.
How did you
How
get
did
that?
you get it? Did you just divide by
So I
100?
did 1.5 gram over the 100 millimeters times 1000 mg. So that gave me 15.
Can you repeat what you just said? Because I'm
1.5 gram over 100 ml.
okay. So then she did divide by the 100 instead of the 50.
Mm-hmm.
But then is it logical though? Is it like the question? Does it?
Yeah, because it was asking for mg per ml.
Mm-hmm.
So
Okay. Yeah, you're right.
Okay, makes sense.
Okay. You good now?
Yeah, but I did it different though. Vera, I like your style. I did 1.5 divided by 1,000. So it gives you 0.015 grams per
Okay.
100. So if you
Okay.
multiply it by 1,000, it gives 15.
Okay. Yeah, it's all in how you're looking at it, I guess. There's different ways you can get the right answer, but. Okay, guys, is there anything else you're seeing that you need me to comment on or look at a correct answer for you or anything?
Mm-mm. So if I'm going back to redo this, especially the ones I didn't even answer, do I put in the same code or?
Yeah, it's the same code.
Okay. All right. Good enough.
And if you, for some reason, you can't see something and you need me to change a setting, let me know. There's only certain settings I can change on this, but I think I have everything set the way that you need. So just let me know if you're having an issue. Does everyone feel better about this test or no?
Yeah, I was looking at because like it submitted the attempt because of the time, whatever. But for the one where it's the oral intake, so I know like the ounce to milliliter, but for the cup of cherry jello and all of that, like, do you still count it as a cup?
Yes,
The only thing you would split into half is the ice chips. Right?
correct, correct.
Okay. Because I did that, and then I don't know how many milliliters did we say was in a cup?
240.
Okay, that's where I messed up then.
So anyway, when you're getting ready for this, just make sure you review some of your conversions because that's usually where someone makes a mistake is doing a messed up conversion, you know? So relook at some of those amounts and make sure that you have those correct. This weekend, I'm going to probably look at the discussion board for our Canvas class here and add stuff in there. So obviously for this first week, I wouldn't have required that, but for next week, week 2, I'll probably start to require it. Doesn't mean that you're getting points for discussion boards. You know, it's just like last term, but you still want to go in there and comment because that's part of your attendance for the class and everything and part of your participation. And I'll try and put things in there that might help you with some of the content for the week and everything too. Okay. I don't know if you guys noticed, I put an announcement on about this, these notes. I don't know if you guys looked at that. This is something I got from someone in Wisconsin. I thought it was kind of cool. So if you think it's helpful, great. If not, then you don't have to use it, but I thought I'd give it to you just in case you liked it. It has a spot where you can put notes from what you've done in your reading. And then if you keep this and take it to class, when you come to class with me, if we talk about something again in that particular topic, then you can add to your notes on the other side to see if you missed anything important. So that's kind of nice. All right, guys, if you feel okay with this math, I'm going to go ahead and get off here and we can call it a day with our lab. Questions about anything?
No.
Okay. All right, well, you guys have a good weekend. If you have problems or questions, just get a hold of me. It's not a problem, okay?
Thank you.
All right, thanks.
Thank you.